We received a lot of calls and inquiries about vaccinations and when vaccines will be available for COVID-19. The vaccine, both the Pfizer and the Moderna vaccine, are available through the hub hospital. Unfortunately, right now, because of state prioritization, only frontline hospital staff, first responders, and other key priority groups are being vaccinated. Over the next several weeks to months, other groups will be allocated as priorities and they will be reached. And so this is going to take some time. Within the county of Dutchess, we have over 300,000 people. And as we go through priority groups, it may take several months for maybe you, the general population, the general public, to be called. So we require patience, and you haven't missed it. The vaccine is becoming available more and more to the general public over the next several weeks to months. As we enter into the new year, it's January, and we've just gotten over the holiday season, Thanksgiving, Christmas, New Year's, and so it's unavoidable that our numbers are rising. Not only that, hospitalization and the number of deaths have increased. And so this sort of highlights the fact that it's very important that people are diligent and adhere to the guidance that we provided over the last several months, all throughout this pandemic. You know what needs to be done, which is very good adherence to hand hygiene, respiratory hygiene, wearing a face covering or a mask, and social distancing. As I mentioned earlier, that our numbers in terms of cases are going up. So it's very important that individuals who test positive go on isolation right away. There is now alignment between isolation and quarantine. Previously, people who were positive or symptomatic for COVID-19 were isolated for 10 days. Now, those that they potentially were exposing were forced to quarantine for 14 days. Well, now that 14-day period has been reduced to 10 days. So there is an alignment with isolation guidance and quarantine guidance. So moving forward, it's 10 days for those who may have potentially been exposed. It's also important that they contact the people that they may have potentially exposed and notify them. What has to be understood as the cases rise, the ability for the limited number of individuals, even though we have quite a number who are doing case investigations, they may not be able to reach you in a timely fashion. So it's absolutely important that when you know your status as a positive case, that you go into isolation for the 10-day period, monitor your symptoms, potentially contact your medical provider and discuss any issues with him or her, and make sure your contacts are notified so that they can be in quarantine for those 10 days.